Welcome, my name is Marcin. I'm a practicing family physician. I'm also a systems design engineer. Today, on February 20th, 2023, I wanted to share with you my impression of the new OpenAI chatbot, ChatGPT. I wanted to frame this evaluation with a conversation I had with my father years ago about the advances in AI. He said, "Marcin, if there will be artificial intelligence, there will certainly be artificial stupidity." With this warning in mind, let's see where ChatGPT stacks up. For the last couple of weeks, I have been trying to use ChatGPT as much as possible. Whenever a question would arise, I would go to it. Let's see how it performs with a relatively simple recall question. On Tuesday mornings, I work in the musculoskeletal injection clinic. One of the conditions we commonly treat there is the Quervain's tenosynovitis. It's a condition where patients experience pain along their abductor pollicis longus and extensor pollicis brevis. We treat this condition by injecting a corticosteroid in between these two tendons. I can easily find these two tendons, but I always have a hard time recalling their names. Let's see what ChatGPT has to say about this. What are the tendons involved in the Quervain's tenosynovitis? I would say ChatGPT performed well here. It did answer my question about the tendons which are involved, gave me some useful information about anatomy and common causes of this condition. My only criticism of this answer is that it says that it is due to inflammation, and our current understanding is that there's actually no inflammation involved in this condition. Let's try another recall question. Explain atrial fibrillation. I will not read this answer out to you, but it is quite impressive. Let's see if a ChatGPT can do a little bit better. Sometimes I need a very brief explanation of a condition that I need to send to a patient. Our gold standard is for that to be written at the 6th grade reading level. Let's see if ChatGPT can do that. Again, a very impressive answer, much better than one I could write in a couple of seconds. Let's see how ChatGPT performs at a more complicated cognitive task. In my practice of family medicine, an example would be evaluation of a possible syphilis infection. So this will start with a screening test. If that screening test is positive, we'll perform a secondary test called RPR. Let's say that the RPR test is negative. Now we need to perform another test to confirm whether this was a false positive or a false negative. We'll perform a test called TPPA. If the test is positive, it suggests a possible syphilis infection. If the test is negative, it could be a false negative. Let's see how ChatGPT interprets a positive TTPA test and a negative RPR. So ChatGPT tells us a positive treponemial palladium agglutination test and a negative RPR could indicate a number of things, but most commonly early syphilis. Let's go back to our algorithm. Possible early syphilis. I would say that ChatGPT again has done an excellent job. By now, I am wondering, as probably are you, if ChatGPT should apply for his or her medical license in California, and if I should be even showing up to work tomorrow. When I was thinking about the license, I remembered that when I moved to California, I noticed that there's a letter in front of the physician license. I also noticed that different physicians have a different letter. I was curious about it and looked it up in the past. So I was curious again, what does ChatGPT know about this? So I asked ChatGPT, what does the letter in front of the physician license mean? ChatGPT gave me an answer that seems quite authoritative. A stands for physician and surgeon, G for a registered dispensing optician, and a number of other letters. Well, let's see what does the Medical Board of California have to say about this topic. So the Medical Board of California tells us that both A and G are physician licenses. Type A is a license of a US or Canadian medical school graduate who followed a certain pathway to their licensure. Type G is also a license for a US or Canadian medical school graduate who followed a different pathway. ChatGPT seems quite off here. Let's ask it for a reference. So ChatGPT provided me a reference which also references the California Medical Board. Let's check out that page. It seems that this page does not exist. ChatGPT does come with a disclaimer that it does not know about events after 2021. However, I do happen to know that these letters had the same meaning for at least the last 10 years. Let's do one more test using this question. What does the letter in front of California Physician License mean? Let's ask ChatGPT the same question twice and see what we get. This is even more concerning. So we see that A still stands for physician or surgeon. Now G on one hand stands for registered dispensing optician. On another hand stands for registered physician assistant. R can stand for respiratory care practitioner or registered nurse. We would expect that we might get a different style of answer, but the answer should not differ in substance. In both cases, ChatGPT references the California Medical Board, and we already have seen what that means. By now, I'm somewhat skeptical about the answers I'm getting from ChatGPT. Let's give it one more question. Which PPI is more powerful, omeprazole or pantoprazole? These are medications used to treat gastroesophageal reflux. So pantoprazole tells us that they are both about equivalent. If you are a gastroenterologist, please leave a comment with your thoughts. Again, I will ask ChatGPT to give us a reference, which ChatGPT provided right away. Let's click those links. Another broken link. Let's click this one. This one works. This one works. This probably would be the best comparative effectiveness of proton pump inhibitors, a systemic review. But actually we are getting a link to an article about using high sensitivity cardiac troponin for exclusion of heart attack. That is interesting. Well, let's see, maybe that link changed. Let's search this site for this article. And it seems that this article does not exist on this site. Difficult to explain what happened here. So let's get back to our original question. Is this artificial intelligence or artificial stupidity? I think it's neither. I think it's a tool and we need to understand its strengths and weaknesses. I will certainly continue to use it as a memory aid for topic I have learned about and need a quick recall, or as a writing aid. I would definitely not use it to answer questions I am unfamiliar with or to learn a completely new topic. Let me know what you think.